Hi everyone, there's Emma, but I'm just going to introduce myself because Emma was just out of the room for a second. My name is Shruti, I'm a postdoctoral research associate on the Inclusivity Project, and I'm going to share a recent piece of work that we've been doing over the last year with one of our project partners. I know it's the afternoon, but I'm going to talk about things that we've been touching upon a lot over the course of the day, so hopefully you'll still be engaged and hopefully this will still be interesting to you at the end of the day. As the title suggests, I'm going to share a piece of work that we've done. It's not research, but it's more of an applied research project, and the outcome of it was a resource that we want to share with small businesses, and I'm going to talk about the process of that resource development and how we want to share that resource. So, as the title suggests, we developed a resource to support small businesses and frontline organizations, so organizations that have frontline duties, develop a culture of inclusivity as they move to hybrid working. When we started this project in 2021, COVID really was defining all of our lives, and that's essentially where this came from. But I will talk about how the process that we developed has long-term implications for inclusion in the workplace, beyond COVID, beyond that particular crisis. So obviously, COVID changed the way that we work. It offered us an opportunity to reimagine what work means to all of us and how we can make that really huge aspect of our lives meaningful in a way that it wasn't before. And that introduced this concept of hybrid work to us. I mean, I don't think it was new, but it really materialized and became very tangible because of the COVID pandemic. So what hybrid work essentially means is a situation where in-person and on-location work are used interchangeably by employees of an organization as per need. Obviously, due to the pandemic, it was forced upon us, but now I think what I want to say is people are starting to realize the value of hybrid working, which means the world has to catch up, the world of work has to catch up. Initially, it was used as a necessary response to the pandemic, but now it's clear that both workers and employers are starting to think that hybrid work is the way to go. There are lots of stats to support this. I'm not going to bore you with the stats, but just to talk about what some of the benefits are. For workers, it allows them the flexibility to plan their days, plan their work around their lives, as opposed to the vice versa. And we've started to realize how important that is to us now. And for organizations and employers, a simple benefit is the overheads associated with running full strength offices. This can actually be managed through hybrid working. Do you need the full strength in the office? Probably not. And if not, those overheads can be reduced. So these are some of the very simple benefits to hybrid working, which is why it's stayed as long as it has. The thing I want to say is why we're doing what we're doing is because hybrid working is still very, very experimental. We don't know a lot about what hybrid work is because all of our knowledge of non-traditional work predates the pandemic, and it mainly has to do with remote working. So we knew what remote working was, but we don't really know what hybrid working is and how we can do that as inclusively as possible. What we really need is a systematic approach to hybrid working. And because of how unprecedented the COVID pandemic was, organizations, especially small businesses, they were really just dealing with crisis as they came about. It was a very unsystematic approach because they had no choice. They had to survive in the pandemic, and this new way of working was upon them, and they just had to deal with it as it came along. But this probably isn't the best approach in the long term. Now that we have the time to breathe and pause and think about how to do this, what we need is a planned and systematic way to create a culture of work that's inclusive and fair. And like I was saying, hybrid work offers us an opportunity to make work more inclusive, more accessible, and more enjoyable to all of us. So why not take that opportunity? Why are we doing what we did? We want to support small businesses. So again, lots of statistics around large organizations. I mean, you read a headline every day, Google's doing this in terms of hybrid working, and Microsoft has done this, but we're not Google and Microsoft. I mean, we're small businesses. We don't have the resources. We don't have the time or the money or the human resource to be able to do these things the way these large organizations do. They have entire departments, entire task forces that are dedicated to reimagining the culture of work. But we wanted to support small businesses and frontline organizations that lack this access in order to be able to do this in an inclusive way. And this is especially important because there's a lot of research to support the fact that small businesses really struggled during the pandemic. And now another crisis is upon us. Obviously, the cost of living crisis is upon us, and businesses continue to struggle. So what we want to do is we want to reduce the burden that small businesses are already undergoing by supporting them with this one aspect of them running their business. So we developed a process, and on the little postcards on your tables, you'll find a QR code to a link to the website where we've published this process as a resource. It's on our website. It's also available as a PDF. If you are a small business and you want to access that, that's available on our website for you to access. And hopefully it's user-friendly. Hopefully that you find that to be useful. So what was this process all about? What we wanted to do was to co-design a hybrid culture of work. So the aim of this project was to support frontline organizations and small businesses to develop a flexible hybrid culture of work that's inclusive, fair, and equitable. We had the amazing opportunity to do this with one of our project partners, Age UK. And we had Tracy's support during the entire process. She was so engaged in the process. And without them, we wouldn't have been able to do this. And this is the case study that we'd like to present today. And I want to talk about co-design, which is what drives this process. Co-design is important. Co-design is also known as participatory design. It is an approach that seeks to actively involve all the stakeholders in the design of a process or a service that seeks to benefit them. So essentially, it's a very consultative, collaborative process. And CIPD, in fact, recommends including input from the workforce on both organizational considerations and potential benefits to workers as they start this process of culture change. I mean, they published a lot of resources on hybrid working, and they recommend co-design, and that's what we've developed our process around as well. And why is co-design important? I mean, in the panel, we heard Jane talk about personhood and a person-centered approach to work. And that's essentially what it is. It's about recognizing the workforce not as this massive one mass, but recognizing the workforce is made up of individuals, and individual needs have to be taken into account if you have to create a truly healthy, happy workforce. What co-design also does is it increases individual accountability and participation in the culture change process. If you're going to transform your culture of work, you want the workforce to participate in that. And the way to do that is to ask them how it should be done and ask them what they need. And that will drive the solution that you have. It's essentially a how-to guide. This is the link that I was talking about. It's a how-to guide. You can find this on our website. The question we were trying to answer is, how can small businesses and frontline organizations co-design a culture change process for hybrid work? While this is useful for organizations which are trying to move into hybrid working, what we've realized is that this is a very adaptable process, and it can apply to any sort of crisis. For example, the cost of living crisis. And I know that Tracy's taken steps already in this regard. Moving on from the hybrid working toolkit, which I'll talk about, what we developed with Age UK, they've moved on to a cost of living toolkit as well. So the process is something that can be adapted to any crisis. And the core of the process is to create a culture of inclusion, and that can be done in response to any crisis. So this is the process. It's a cyclical process, so it's not a linear process. It doesn't have a first and a last step, but it's an iterative process. The first step is a survey, and I'll talk about that in a little bit depth. The next step is an in-depth discussion, like a focus group, if that's a term that's understood, but it's an in-depth discussion to explore gaps. Then we have 2 steps to explore potential solutions, and finally we hope that will lead to a draft hybrid policy, which will again go back to the workforce for feedback. So essentially it's an iterative process without a start and an end point. Like I was saying, the first step is a survey. A survey is a really quick and easy way of gathering a large amount of data from a large group of people. Obviously, with small micro businesses, there aren't a large number of people, but it's a quick way of identifying where the issues lie and what people want. And you can use multiple choice to do this. But what it'll give you is it'll open up discussion points for the next step, which is the in-depth facilitated discussion. This is really the core of the co-design process. This can be done by an external facilitator. But what we really want here is it'll help streamline we want to streamline the survey findings into a discussion that can actually explore gaps. This is done through open and active dialogue between the facilitator and the workforce. It helps to dig deeper into issues that are important from both the operational perspective for the organization, but also from the perspective of the workforce in terms of their individual needs and wants. And it's very essential that these discussions provide a safe space for the employees. When we did this with Age UK last year, I think the feedback that was really important to us, and that, well, it wasn't surprising, but I think we were surprised by how impactful that was that it created a safe space at a time that was very critical. We were just coming out of lockdown, and we had these discussions with Age UK, which was facilitated by me, and I'm an external facilitator. They hadn't met me before, but what it did was it provided the workforce with a safe space to talk about things that they had been dealing with, that they hadn't had an outlet to do before that because we had just come out of the pandemic. And that's what we want through these discussions. We want this to be a truly consultative and collaborative space that people can actually air their concerns openly and sort of candidly. We think that, a good number is about 10 to 12 participants, a small subsection, but it has to be representative. And it's not one discussion. It could be multiple discussions, and the findings from the first discussion will then inform the discussion guide and how it changes for the next discussion. So the number of discussions that you want to have depends on you as an organization, what your needs are, how many issues come up, and what needs exploring. But this is the format that we recommend. That leads us to the next step, which is exploring potential solutions. Now, this is a 3-stage process. So this is going back to the drawing board for the organization and looking at 3 things. The first thing is to revisit organizational purpose and goals to set the context for the transition. So this is for the organization to pause and think about, are there any changes to the services we offer as a result of this crisis that we're facing? Are there any changes to the responsibilities that we have to our funders or other organizational goals and outputs as a result of the impact that we're facing from the crisis? And I say crisis, it used to be COVID, but now we know that, it's cost of living, it's climate change, it's so many other things. So the first step is for the organization to really ask themselves the question, what changes need to be implemented in the short term, and what are the long-term goals of the organization to respond to this crisis? The second thing is re-examining the individual roles and responsibilities of staff. So this is asking the staff if there are any changes to the roles and responsibilities that they have within the organization. Are there any major constraints or changes to how certain staff operate or in the duties or the roles that they perform within the organization as a result of what's happened? And how can the organization take on board team or individual reassessment of their working conditions? Can they take it on board? Do they have those resources? So this is the next step. And the final thing is what is realistically plausible. So reassessing or reallocating organizational resources. So we know what we can do. We know what's changed. We know what the workforce wants, but what can we realistically do to support the workforce? So these are the 3, these conversations are very important because that really sets the blueprint for what is possible. So what we have in the in-depth facilitated discussions are the workforce needs, concerns, and preferences. And then we have sort of what is possible from the organizational perspective. And a Venn diagram of that is what we think can lead to a draft hybrid work blueprint. And I say hybrid work there, but it could be anything, draft culture change blueprint, which you then take back to the organization. And that is, again, the essence of co-design. So it's not something that, it's not a closed room decision that's made. This is the hybrid work policy. Here you go, and now this is how it's going to be. You take that back to the organization because you've designed these potential solutions, but then we need to ask the people that told us what they wanted if this works for them in the first place. So the blueprint is the organizational perspective of what is feasible, but it has to be flexible, it has to be adaptable, and it has to be amenable to feedback from the workforce. And this is really crucial to co-design. This is the stage where you invite feedback from the workforce, much in the same way that we did the second step, which is through in-depth facilitated discussions. Again, you can have as many as you need, and again, it's a safe space for people to say, well, this doesn't work for me, this is not what I wanted, this is not the outcome that I expected. But it is, again, a safe space for people to share how they feel about the changes that have been suggested. So this leads us to sort of the trial stage. So once you've co-designed the solutions, you've come up with something that makes most people happy, we then trial what we have. And this is the draft hybrid work policy that I was talking about. Again, it's an iterative process. You develop a draft hybrid work policy, you invite feedback from the workforce, incorporate changes and amendments, implement the policy changes, and then ask for feedback and periodic review and amendment. So what we suggested and what Age UK did was trial with small teams with non-frontline staff, so that any sort of fallout from change in policy, change in practice, or change in services, you can recover from that quickly if it's non-frontline staff. And then, when there are successes, you roll them out through the organization. But the most important thing is really build in opportunities for review, for feedback, and revision. And again, when you implement a co-design process of this nature, you really tell your workforce, this is a safe space. You can come to me with what works and what doesn't work, and we'll do our best to sort of go forward with this. And it's important that the hybrid work policy or any culture change policy is a live, evolving document. And I want to highlight something that Tracy said in the panel. Obviously, we talked a lot about flexible work when we talked about hybrid working with the Age UK workforce. And at that time, there were a lot of people that wanted remote working to continue. They wanted to have that option of hybrid working to continue. But then the cost of living crisis happened. It's not something we predicted last year. So now, I know Tracy made a mention of the fact that they're having to reimagine what work looks like again after they did the whole thing with hybrid work, because people are now wanting to come into work more often in response to the cost of living crisis. And this is what I mean by any sort of culture change process like this has to be live. It has to be evolving constantly. And what Age UK has done is they're having these conversations repeatedly. They're creating that safe space where people feel like they can come back and say, well, what worked for me 6 months ago doesn't work for me anymore, because in response to this, I need a different sort of solution. And that is that's the essence of co-design, and that's the essence of the process that we're recommending. I want to quickly touch upon what we found. So this is another resource that we've published on our website. There are organizations that again have the time and capacity to do the co-design, that have the resources to undertake the process from scratch. But for organizations that don't have the time or the inclination to undertake that process from scratch, we've published a quick and handy resource on what we found from our experience with Age UK. So it's evidence-based because we did this process with Age UK. We had a lot of interesting findings, and we think that needs to be shared. So essentially, the question that we're answering here is, what should small businesses and or frontline organizations be mindful of as they navigate the transition to hybrid working? So this is what we found from our discussions with Age UK staff. It's essentially a case study. It's an evidence-based guide on what to expect and what to be mindful of if you are an organization that's considering hybrid working. We had some very interesting but overlapping themes. These are only artificial differences. They all overlap, they're all very connected to each other, and they might not be surprising to a lot of you. We've talked about this before in various forums, and I know that this resonates with a lot of you. So some of the themes are productivity, connection and social isolation, team building and support, burnout, and trust and transparency. And I'll touch upon that very, very quickly. So productivity, this word sounds very different now than it did 2 years ago. I think there are a lot of anxieties. We've heard from staff that there are a lot of anxieties around how productivity is measured, how performance is measured, how outputs are measured. So lots of anxieties around how to manage work at home versus how to manage work in the office, which was a relatively straightforward process. So we've understood that we really need to start reimagining what productivity and performance means in this new culture of work, in this new hybrid work, because visibility becomes an important aspect here, because out of sight can often mean out of mind, and this is the anxiety that our workforce has. So if I'm a remote worker, if I'm a hybrid worker, are my milestones being recognized? Are they being recognized on par with people that go into the office? And is that something that I need to take into consideration if I have to consider flexible working? The next thing is around team building and support. So especially in the absence of a traditional office, it's very difficult for people to work synchronously. So asynchronous work is when the full strength of a workforce isn't expected to be online or at work at the same time, which is completely fine. But if you don't have a plan to approach this in a way that it doesn't affect your organizational goals, it can be quite daunting to staff and to the organization. and especially responding to the sort of challenging nature of work that Age UK does. A lot of frontline staff at Age UK felt that in the absence of the office space, they'd lost that, that space to debrief and de-escalate, because the work that they do is so challenging. And how do we address this? How do we address debriefing and de-escalation and peer support for employees that have frontline duties in a hybrid work culture? That's something that we need to start thinking about really quickly. And again, not everyone sits around a team. Some people work in the absence of a team, so we need to create virtual teams, and this is the feedback that we got from the workforce in terms of losing that connection to their colleagues and peers. The next thing is connection and social isolation. So with hybrid working, there's a real danger of becoming isolated, becoming siloed, which is especially challenging for staff in Cornwall, which is so geographically dispersed. It's challenging for staff that live alone and they depend on the office environment for social interaction. And again, this is something that we need to think about, because people were sick and tired of sort of working on their kitchen tables. They were sick and tired of not seeing another person for days on end. And if hybrid work is going to go forward, then we need to reimagine what connection and social isolation mean. Because in the absence of physical social spaces, we now have virtual social spaces. But I think you'll agree with me that it's not the same socializing on Teams and Zoom as it is to go to the pub after work, or go for a coffee, or do a yoga class together. It's not the same. And I think the pandemic really isolation was at an all-time high during the pandemic, not just because of the virus and not being able to interact with people, but that people weren't able to go into work. And I think we underestimate how important work is for our social lives. Burnout is another, there's a risk because the speed and intensity of work is higher at home. This is the sort of response that we were getting from the Age UK staff. And also, while we talk a lot about flexibility and how flexibility can make work more accessible to people with caring responsibilities, I think we often neglect that this is a double-edged sword, because people that have caring responsibilities and opportunities for flexible work means that they have to balance these two things. And it can be quite precarious as well when you're at home managing either elderly family members or children or pets. So it can be quite stressful. And this adds a layer of stress to work that already is changing. And in the absence of the physical workspace, people can't really see. They can't see that you're sort of struggling. And you don't have that visibility where you can go to your line manager or your colleague and say, I'm struggling. No one can see that you're struggling if you're not in the office. So there's a real risk of burnout. But we do think this is where technology can really play a huge role. For example, we've heard that from Age UK, some of the solutions that they had was optimizing diary management using technology. So people were complaining that they were losing that sort of break between meetings. It was almost like go from one meeting to another just because it was possible to do on Zoom and Teams. But we talked a lot about how technology can help manage your diary in a way that you don't have those back-to-back meetings. Or for example, taking breaks. I mean, reminders to take breaks. We all forget to take breaks now and then, and that can lead to burnout as well. So technology can help with things like this. And finally, trust and transparency. I think this is really important because we talk about flexibility as if it's available and accessible to everyone, but it's not. Not everyone has access to flexibility in the same way, and not everyone has a choice of flexibility. Again, we've talked about flexibility a lot today, but on another piece of work that I did, we looked at some of the qualitative literature on flex work, especially for older women. And the sort of gendered perspective that we had was we always assume that for older women to re-enter the workforce, we should give them access to flexible work. But from some of the qualitative research that we read around this, we found that a lot of older women don't want flex work because it's the kind of work that they've done all their lives to fit work around their lives and around their caring responsibilities. So flexibility looks very different to every person. And really the way to ask people what flexibility means to them is to have these consultative, collaborative sort of spaces where people can share what flexibility means to them, because it's not sort of a blanket definition. Managing expectations is key, and this is that step where I was talking about how what's feasible for the organization needs to be communicated really transparently to the workforce, because we are doing this in a consultative manner, and the way to really, you have to close that feedback loop and tell people what's possible and what's not. So to be really transparent can help people feel that the process was accessible, was equitable, and was fair. So we talked a lot in those discussions about how any sort of hybrid work policy has to be explicit but not prescriptive, which means people should have access to the hybrid work policy and have a hand in saying how that happened. So I just want to round this off with some key considerations from the work that we did. One size doesn't fit all. We've read this a million times, which is why we recommend this process to every small business that can do it. Because learning from the findings from another organization might work in the short term, but really I think the core of this is to do the process within the organization, because one size doesn't fit all. It has to be tailored to organizational needs, capacity and goals, but also tailored to staff. Again, this is the person-centered approach that we were talking about earlier. Culture change is a slow process. I'm sure if we ask Tracy, she'll talk about how they're still doing this process. We started over a year ago, but I know for a fact that they're still implementing a lot of changes within the organization that came from those discussions, and further discussions are coming out of those discussions. So we have to know that this is going to be a long process. And the most important thing is periodic review and feedback. And again, an example of that was the cost of living toolkit that Tracy was talking about, wherein hybrid work looked very different 1 year ago than what it does now, because we have to take a new crisis into account, which is cost of living. And the way we know that is through periodic review and feedback. I just want to talk, the last slide I promise, on Age UK's response to what we did. This is an ongoing piece of work, so the case study is still ongoing. We don't have an endpoint, and we shouldn't have an endpoint, but I just want to touch upon some of the really interesting things that Age UK has done in response to what we found last year. The first thing is flexible and agile working in response to crises such as COVID and cost of living. So Tracy was talking a little bit about how their work week now is a 7-day work week, wherein people get to choose what each person's work week looks like to fit their work around their lives. And I think that's a fantastic approach. It really tells people that life comes before work. And I think that's a really great response that Age UK has had. And again, the cost of living toolkit that they're working on, again, is a very consultative piece of work where they've had discussions with their workforce on how the cost of living toolkit should be developed and what it should look like. They've re-energized their healthy workplace team. I've had a couple of discussions with the healthy workplace team. They've really taken all of the sort of points that are in the healthy workplace checklist, and they've reimagined what it looks like in response to what we found in those discussions and some of the findings I spoke about today. In response especially to the lack of access to support, mental health first aid has been made a priority in Age UK. So there are more opportunities for peer support, more opportunities for reflection and mentoring in the organization than there were before. And essentially, they're now developing sort of personalized approaches to needs. So it's not a blanket organizational response to what is needed in response to, say, hybrid work or cost of living, but rather they've developed a personalized approach to need, which is sort of the crux of what we've been talking about. And finally, that bit about connection and social isolation has really struck a chord. So what they're doing is they've used a place-based team development approach, which means they've moved away from having centralized hubs, and they've created sort of local hubs. And I know Tracy talked about this earlier as well. They have local hubs dispersed all over Cornwall to connect the staff in Age UK that work in those local hubs. So they may not be part of the same team, but by creating these local hubs where people can go meet, work, and socialize, they're creating a sort of a structure of support, peer support, especially for people that don't sit around a team or people that live alone. So these are some of the really interesting responses that Age UK has had to their co-design process, and I'm sure Tracy will be able to share any more that they had if we have a chat with her after this. But that's essentially what I wanted to talk about today. I want to thank all of my co-authors, Professor Emma Pland, who's here today, Professor Victoria Tischler, and Dr. Susan Ray, who aren't here today. And of course, I want to thank Tracy for being such an engaged partner through this entire process. Obviously, this wouldn't be possible without them. And I want to thank all of the staff and volunteers at Age UK for being so engaged in the process. And thanks to them, we have this process that we can share with other small businesses. Yeah, that's me. And if you have any questions or comments, I'm happy to answer them now.
Thank you. Hi, Anne from the Federation of Small Businesses. Great presentation, really interesting stuff. I'm just wondering, we were talking about safe spaces and the safety of people being able to say exactly what they feel, and of course your data relies on people being honest. Yeah. It's all very sensitive information that we're dealing with here. How can we, or how did you ensure that actually people weren't just saying, you know, the right thing? I mean, businesses obviously want to be seen to be doing the right thing, so they might say, yeah, that sounds like a good idea, I'll say that in this survey, but in the back of their minds they're going, yeah, we're not really going to do that though, are we? So how do we know that this is actually, did you give any sort of safe space sort of advice to people, or give them any sort of information that they could say, I really can say what I think here? It's the honesty thing I think I'm thinking about.
Yeah, you're absolutely right. I think the survey is a space where people don't actually feel completely anonymous, or they don't have, I don't think the survey gives that opportunity for people to be completely candid, because there are a set number of responses. But I think that's what the facilitated discussions really offers. And again, I was recommending an external facilitator, which is what we did with Age UK. Of course, you can have an internal facilitator, but I think people become more candid, become more honest if there's an external facilitator present. And I don't know how to answer that question, because I think like I said, we did this process with Age UK at a time where people were really willing to talk. And I think everyone had great ideas that they wanted to share on how to move this forward. So I thought that the conversations were very candid, were very brutally honest. And I think it's the culture of the organization as well. I think they have had that culture of honesty and openness. We actually had a staff survey that Age UK had done, which guided our discussion. And you could see the sort of depth of honesty in that survey as well. And I think it starts from that culture perspective, where the organization has to set that in place before we do this. Unless Tracy had any comments. Do you want to add to that, Tracy?
Yeah, I think the point is about culture, actually. So there is something about embedding a culture of continual improvement within an organisation, which is based on individual feedback and the feedback of customers. And that's part of what we do. We try and encourage and engage positive, constructive challenge. Because if you don't, how do you know that you're doing a good job? I don't really understand organisations that don't like complaints coming in. I think they're a marvellous way of improving the services. So I think there is something about engendering that culture of listening and responding. But in terms of Shruti's work, no senior managers were involved at all in any of the consultation and engagement with the staff. Shruti kept it entirely separate, so it was entirely anonymous. And staff were engaged to participate in whichever way they wanted. So time was given, it was done at a time that was convenient to them. They all knew that Shruti was recording, but those recordings weren't available for any of us to hear. They didn't need to use their camera, they didn't need to use their name, so we kept it as anonymous as possible.
Say the wrong thing. So I think it's important to make sure that you have that sort of safe space thing, and it's good to see that culture. But I think if you did that more generally, I think you'd really need to have a real framework of making sure that people really did feel that they weren't going to be berated or whatever for saying the wrong thing, and actually being genuinely very honest, because I think they're in really, really hard times at the moment. Yeah. And where people are feeling like quite desperate and so on, they'll say what you want them to hear, or what they want you to hear, but actually what they're feeling deep down inside, sometimes they may feel that that's not quite the answer that they get, and that's kind of the problem we have when we're talking to businesses, that they might say what you want to hear. So yeah,
you're absolutely right. But I think that's when you embark on a process like this, where you're telling staff up front that we're doing something that's collaborative and consultative, hopefully that creates a sense of trust with the organization. I think that's the first right step to implementing a culture of I think fairness, but also telling people that this is a safe space. Thank you all so much.